Hello everyone and welcome to my channel Manar Atif for medical advice and instruction. Today I will talk another disease. I will talk autism spectrum disorder. I will talk about definition, symptoms, causes and treatment. Autism spectrum disorder is a serious neurodevelopment disorder that impair child ability to communicate and interact with others. It also include restricted, repetitive behavior, interested and activities. This issue causes significant impairment in social, occupational and other areas of function. Symptoms: some children show signs of autism in early infancy. Other children may develop normally or for the first few months or years of life, then suddenly become withdrawn or aggressive or loss of language skill they have already acquired. Symptoms: social communication and interaction. Forced to respond to his or her name or appear not to hear you at times. Resists cuddling and holding and seem to prefer playing alone. Has poor eye contact and lack facial expression. Doesn't speak or has delayed speech or may lose previous ability to say words or sentences. Can't start a conversation or keep one going or may only start a conversation to make requests or label items. Speak with an abnormal tone or rhythm. May use sing-song voice or repeat like speech. May repeat words or phrases verbatim but doesn't understand how to use them. Doesn't appear to understand simple question or direction. Doesn't express emotion or feeling and appear unaware of other feelings. Doesn't point at or bring objects to share interest. Inappropriately approaches a social interaction by being passive, aggressive or disruptive. Pattern of behavior: perform repetitive movements such as rocking, spinning or hand flapping, or may perform activities that could cause harm such as head banging. Develop specific routines or rituals and become disturbed at the slightest change. Moves constantly, may be uncooperative or resistant to change. Has problem with coordination or has odd movement pattern such as clumsiness or walking on toes, and has odd stuff or exaggerated body language. May be fascinated by details of an object such as the spinning wheels of a toy car but doesn't understand the big picture of the subject. May be unusually sensitive to light, sound and touch and yet oblivious to pain. Doesn't engage in imitative or make believe play. May become fixated on an object or activity with abnormal intensity or focus. May have odd food performance such as eating only a few foods or eating only food with certain texture. When to see a doctor? Doctor doesn't respond with a smile or happy expression by 6 months. Doesn't mimic sound or facial expression by 9 months. Doesn't babble or coo by 12 months. Doesn't gesture such as point or wave by 14 months. Doesn't say single word by 16 months. Doesn't play, make believe or pretend by 18 months. doesn't say 2 words, phrases by 24 months, loses previously acquired language or social skills at any age. Now I will talk causes of autism. Genetic problem such as Rett syndrome, Fragile X syndrome, or genes may affect brain development, so affect brain cell communication. Environmental factors such as viral infections, complications during pregnancy, or air pollution. Now I will talk about treatment, behavior, and the communication therapy. Be patient until the desired results are achieved. Don't be overly tolerant when doing something wrong because that makes him go too far. Ensuring that child is always busy and developing his social interactions so that he has a permanent relationship with the world around him. Work on teaching him respond quickly to the order for perception. A child with autism has a weak sense of dangers and may harm himself without realizing. Start with a simple and short commands so that he can implement them easily. Words should be supported by signs and expression, combining the face and the body part. Make him try to ask for what he wants in any way. Control the child's excessive activity and work to attract his attention. Make sure that your eyes light is at his level while talking to him and asking him for any request. Be sure to talk a lot with him to learn the skill of listening and listening with the passage of time. Avoid teaching him many skills at once and start with him slowly. Sign language is more effective in communicating with an autistic child. Hyperactivity can be reduced by limiting the movement of the child by teaching them to sit on the chair and teaching them a new skill while sitting. Anger tantrum are usually used by child as means of obtaining something or getting rid of something, so you must ignore the child request and anger at the same time. Sometimes the child embraces you in response to his request, which is a kind of expression of his ability to perform, and in this case you must change your style. Make sure to teach the child an alternative behavior for any wrong behavior he does. Focusing on joint imaginary play with your child works to expand his perception and increase his linguistic awareness. Now I will talk about instruction. Instruction: pay attention to the child's personal hygiene, taking vitamin during pregnancy, stay away from people who have infectious disease, avoid viral or bacterial infections during pregnancy. The environment in which the child lives must be safe. Teaching autistic child drawing, playing music, and handcraft. This is painting for autistic child. I will learn embroidery painting, seashell painting, music, playing music. This is activity you must to learn autism child. Now I will talk about diet of autistic child. Avoid foods that contain gluten and casein. Food should be easy to chew and swallow. Avoid packaged and processed food. Avoid animal milk and take plant-based milk such as coconut milk, almond milk, and rice milk. I provided in my channel نجوم زمان 1 Arabic channel food useful for an autistic child, and I will provide in my channel نجوم زمان 2 food useful for autistic child. This is autism syndrome. I will take about definition, causes, treatment, and instruction. Thank you for watching, and goodbye.